Very good evening all the student. Today we are going to discussing about one of the basic pathological phenomena, that is the inflammations. So let us study in detail. Acute inflammation we are covering in the three part. Part 1 we are discussing about the vascular events of acute inflammation, and part 2 we are discussing about the cellular events of acute inflammation, and part 3 we are going to discuss about the chronic inflammations. So let us study what is today's outline. We are going to discuss about the definition of inflammation, cardinal signs of inflammation, type of inflammations, and we are going to discuss about the acute inflammation, that is the vascular event we are going to discuss about today, and end up with the top 6 questions. So let us see the etymology or the word meaning of the inflammations. Inflammation taken from the Latin word inflammare. The word meaning is to set on fire or to burn off. The simple meaning is burning. Let us see about the definition from the source book. It defined as local response of living mammalian tissue to injury due to any agents. It is defined as a local response of living mammalian tissue to the injury due to any agents, or simple definition, complex reaction of vascularized connective tissue. So this is a very important word, complex reaction of vascularized connective tissues. So let us study the outline of the inflammations. So this is the tissue. We have 4 types of tissue: epithelial tissue, muscular tissue, connective tissue, and nervous tissue. Any type of the tissue, the pathogens enter to any type of the tissue. So immediately our body will identify the pathogens. So the question is, who will identify the pathogens? There is, our body have toll-like receptor or pattern recognition receptor. So that will identify our pathogens. So once it is identified, this will give next step is to remove the pathogens. So the question is arise again, who will remove the pathogens? The simple answer is our white blood cell will remove the pathogens. Okay, where is the white blood cell will be there? So you know, it will present into the blood, and it is in the blood. Blood is there in the blood vessels. There are 5 type of white blood cell, that is neutrophil, lymphocyte, monocyte, eosinophil, and basophil. So these cells are responsible for removal of the pathogens. So that's about the simple summary of the inflammations. So always here, why I am talking here, always remember there will be the first, there will be changes into the blood vessels followed by changes into the tissue. So this is a simple understanding. First is the vascular event followed by the cellular event. So if you see the tissue, is the tissue, there is a parenchymal cells made up of parenchymal cells, and there is a basement membrane, and there is a stromal cells will be present, and there is a each tissue having the blood vessels, and there is a nerve fibers and some of the macrophages, and there is a stromal layer. So this is the basic structure of the any part of the tissues. And if you see the blood vessels, the basic understanding of the blood vessels, the blood vessel is made up of endothelium. This is the endothelium, and there is a blood vessels. So here we are going to, very important one, there is all the blood cells will flow in the central axis. So all the blood vessels will be there in the central axis, or there is a fluid part of the blood that we are calling as a plasma, which is present into the peripheral axis. So this is the normal blood flow. So this type of normal blood flow we are calling as a laminar blood flow. Very important to understand. So this is about the tissue and blood vessels. So now we will see white blood cells. There are 5 type of white blood cells. Neutrophil, there are so many lobes will be there, otherwise known as the PMN, polymorphoneutrophil, and eosinophil, and basophil, monocyte, and lymphocyte. So what is the purpose of inflammation? Inflammation is our productive mechanism due to, it is one of the component of the innate defense mechanism. So very important to understand. It is one of the innate defense mechanism. When it comes to the immunity chapter, we will let me know the detail about the innate immunity. So let us see the short discussion about the causes of the inflammation. There are 4 causes. physical causes, chemical causes, immunological causes and microbial causes. Mainly the microbial causes is the important. So now the question is come, how to identify the organs are inflamed. This is a very important note. So all the organs are inflamed. So if you know the suffix, that is a itis, that is means inflammations. So in medical terminology there are some of the suffix or postfix responsible for the identifying the disease conditions. Example is OMA. Any disease ends with the OMA, it is a tumor most of the time. Some exception will be there, so that we'll discuss under the chapter of the tumor. Megali, any disorders ends with the megali, that means enlargement. Splenomegaly, hepatomegaly, these are examples. Any disease ends with the EMA, leukemia, anemia, that means related to the blood disorders. Any cells ends with the cyst, fibrous cyst, that is a mature cell. Any cells ends with the blast, myeloblast or fibroblast, that means it is a immature cells. And any disorder ends with the RIA, that is a discharge or flow, dysmenorrhea, that is a discharge or flow. So this is the very important to identify here. Very important thing is this one. All the inflammatory disease ends with the itis. That is a very important things of today's class. So how to pronounce the inflammatory organs? So this is simple understanding. If the name of the organ is the anatomical organ plus itis. If the organs inflamed is the appendix, so appendix and plus itis, appendicitis. Tonsil, tonsillitis. Stomach, we are calling as the gastric region, so it is a gastritis. If you take the stomatitis, that is the inflammation of the mucous membrane of the mouth. So here there is a gastritis. Meningitis, meningitis. Liver, that is a hepatic region, so hepatitis. So this is some of the inflammations. Okay, now very important to know is the cardinal signs of inflammations. First one, rubor, the affected part become redness. Then calor, the affected part become heat. Tumor, the affected part is swelling. Dolor, the affected part become painful. The last one, the affected part is functionalacia, that is a loss of function. So this is the 5 cardinal signs of the inflammation: rubor, calor, tumor, dolor and functionalacia. Now we study the type of inflammations: acute inflammation and chronic inflammations. So today's class we are discussing about the acute inflammations. So let us discuss about the difference between acute inflammation and chronic inflammation. Very important for the short note. Onset, the acute inflammation is sudden and short-lived, and whereas the chronic inflammation is gradual and long-lived. Duration of acute inflammation is the very short, that is persisting for minutes to hour, where there is a chronic inflammation is long, persist for day to weeks. And cells of acute inflammation is a neutrophil, and cells of chronic inflammation is the mononuclear cells, that is lymphocyte, macrophages and plasma cells. Very important for the MCQs. Primary chemical mediators are vasoactive aminase in case of acute inflammation and echinocenoid in case of chronic inflammations. Specificity, the acute inflammations are known as the non-specificity. It will not go for the any organs. Any organs enter to or any pathogens enter to our body, it will react. Acute inflammation. Chronic inflammation is specific to the pathogens. When it comes to the immunity chapter, we will explain. Nature of the response, it is mostly physiological response. All acute inflammation mostly physiological response, where there is all chronic inflammation mostly pathological response. Tissue damage, very mild in case of acute inflammation and very severe in case of chronic inflammations. Some of the exceptions, we know the neutrophil is involved for the acute inflammation. Some of the exception is viral infection, the lymphocytes will be involved. In case of now COVID-19, the virus, the lymphocytes will be involved. Some of the allergic disorder, eosinophil will be involved. And acute typhoid fever, lymphocyte is involved. And chronic pseudomonas infection, neutrophil is involved. As per the logic, the monocyte or lymphocyte will be involved for the chronic inflammation. Some of the exception is that in chronic pseudomonas infection, the neutrophil is involved. So this is the difference between acute inflammation and chronic inflammations. So here it is the neutrophil, very easy to understand. Neutrophil, you can see the lobe, here 1, here 2, here 3 and here 4. So that is known as the polymorphoneutrophil. Here also we can see the neutrophils. Why we are talking neutrophil? Because neutrophil is responsible for the acute inflammation. This is the lymphocyte is responsible for the chronic inflammations. Neutrophil, here neutrophil, and this is the lymphocyte. The neutrophil responsible for the acute inflammation and monocyte and lymphocyte is responsible for the chronic inflammations. Neutrophil and lymphocyte. So let us study about the acute inflammation. So as we studied into the acute inflammation, the main important cells of acute inflammation is the neutrophil. So let us study about the summary of the acute inflammation in short. So any cause, we can take it as a microbial cause or pathogens that will affect to the any tissues. So immediately the pattern recognition receptor, all told like receptor, will identify these pathogens and informations given to the neutrophils. So immediately the cytokinin communications that leads to accumulation of the more and more neutrophil to the affected site. So the movement of the neutrophil to the affected sites that leads to the end result is killing and eliminations. So this is a simple understanding. So this is the first one. The pattern recognition receptor will identify the pathogens, will give the informations to the neutrophil. So the informations smell the cytokine communication, reaches to the affected part, that is a movement that is reaches to the affected part, that is known as the chemokines. Then the third one, killing or elimination of the pathogens. This is a simple understanding of the acute inflammations. So for our better understanding, acute inflammation we divided into the two type of events, that is a vascular event and cellular event. So today we are going to discuss about the vascular event. So vascular event again divided into the two type, hemodynamic changes that we are calling as a HDC, and next one is the altered vascular permeability. And cellular events also, there are two events, leukocytic exudation and phagocytosis. So this is a summary of the acute inflammation. So today we are going to discuss about the vascular event, simple understanding of the vascular event. So let us study about the vascular event in short. Vascular event. So the question comes where these vascular events occur. Mainly occur into the microcirculation, that is arterioles, venules and capillaries. Let us discuss about the hemodynamic changes. Hemodynamic changes, for our better understanding, it divided into the four part. First one, transient vasoconstriction. Second one, persistent vasodilatation. And third one, increased vascular permeability. And fourth one, slowing or stasis. We will study like a story. The first one, transient vasoconstriction. The word meaning of transition means temporary vasoconstriction. So first vascular immediate response mainly into the arterioles. So you can see it here. There is a normal blood vessels. Once the normal blood vessels injured by any microbial or any external or internal causes, that leads to, in order to prevent some of the bleeding, so immediately the blood vessels undergo for the vasoconstriction. So this is the first vascular immediate response mainly occurring into the arterioles. The duration of vasoconstriction is 3 to 5 seconds. So the question comes why the vasoconstriction is occur. The vasoconstriction is mainly due to the neurogenic lesions. Okay, so here things to remember, this is the transition, that means it is a temporary vasoconstriction. The duration is 3 to 5 and is occurred due to the neurogenic lesions. Some of the chemical mediators are also responsible for the vasoconstriction, that is a thromboxane A2 and leukotrienes C4, D4 and E4, very important for the MCQ. This is the first event. We'll go for the second, that is the persistent vasodilatations. It's a delayed response mainly occurring into the arterioles. The duration is 6 to 30 minutes. You can see here the first is the normal blood vessels. The first will go for the vasoconstriction, that is persisting for less than 5 seconds. Then we'll go to the undergoes to the vasodilatations or dilations. The vasoconstriction leads to increased blood flow to the affected area, that leads to the vasodilations. So this leads to, there are two cardinal signs. One is redness, rubor, another one is the calor, that is the heatness. So there are two cardinal signs comes because of the vasodilatations. That is very important for the MCQs and Viva. Some of the chemical mediator also responsible for the persistent vasodilatation, that is histamine, prostaglandin and nitric oxide. The third one is increased vascular permeability. So here the normal cells leads to vasoconstriction, the first event, then goes to vasodilatation, then third one it is known as the increased blood supply. So why? The elevation of the local hydrostatic pressure leads to increased blood flow. We have seen vasoconstriction. So because of vasoconstriction, there is a more blood flow to the affected part, that leads to the vasodilatation. Once the more blood supply, that leads to increased elevation of local hydrostatic pressure, that leads to transudation of fluid in the extravascular space to the from blood vessels from here to here. So that leads to the swelling. So this is the second cardinal signs what we are calling as a tumor. So this is the third one. So the first cardinal signs, heatness and rubor, is occurring because of vasodilatations, and the swelling comes because of increased blood supply. So the question comes why it is increased blood supply? Because of vasodilatations. Why there is vasodilatation? Because of vasoconstriction, there is so much blood supply to the affected part. This is the third phenomena, that is increased vascular permeability. The fourth one, some of the chemical mediator also responsible for increased vascular permeability, that is platelet activating factor, that is a PAF, histamine and bradykinin. The last one of hemodynamic changes is a slowing or stasis. So here you can see there is a vasoconstriction, leads to vasodilatation, then leads to increased blood flow, that leads to swelling. We have seen swelling. So that because of swelling, the fluid part will comes out from the blood vessels to the extravascular space, that leads to accumulation of the more blood cell. So that leads to the stasis. So increased concentration of the blood cell due to fluid loss. So that fluid loss occurring into the increased blood flow, that leads to increased blood viscosity, that leads to slowing or stasis. So that's about the hemodynamic changes. So here it is a simple understanding about the hemodynamic changes. The first one, normal cells undergo to the vasoconstriction, then undergo to the vasodilatation, then goes to the increased blood flow, leads to stasis. So this is the first hemodynamic changes. Now let us discuss about the altered vascular permeability. So altered vascular permeability we are discussing under the two small heading, that is the Starling's hypothesis and endothelial changes. So what is Starling hypothesis? Starling hypothesis tells about two pressure, that is, one is hydrostatic pressure, another one is the plasma colloid osmotic pressure. These hydrostatic pressures depend upon the water and plasma colloid osmotic pressure depend upon the proteins. So what is the function of this hydrostatic pressure is outward movement of the fluid from blood vessels to the extracellular space. The function of plasma colloid osmotic pressure is inward movement of the fluid from extracellular space to the blood vessels. So let us discuss in the diagrammatic representation. So this is a normal, I am talking about the normal fluid exchange. There is the arterial end and this is the capillaries and this is the venule end. So what is the reason? What is the normal? In arterial end, the HP pressure here it is the 30 and PCOP it is 24. So 24 minus 30 minus 24 it is a 6. So 6 is, which one is HP is 6. So what is the function of HP? Outward flow of the blood from the blood vessels to the extracellular place. So the blood will come to the extracellular space. In venule end, you can see the HP is 20 and PCOP is 24. You can see 20 minus 24, there is a minus 4. So what is the this PCOP is increased. What is the function of PCOP? Inward movement of the blood from the extravascular space to the blood vessels. So there is a inward movement of the blood. So here 6 millimeter of mercury comes out to the extravascular space and 4 millimeter of mercury it goes to the venule side. So remaining 2, there is another mechanism is known as the lymphatics. So that lymphatics will carry about the 2 millimeter of mercury of the blood to the again to the venule sides. So the end result is there is no fluid exchange, there is no fluid accumulation. So this is a normal fluid exchange happening in the body. What happens in inflammation? So in inflammation, the HP is 50 and PCOP is 24. So 50 minus 24, so 26 millimeter of mercury of the water will comes here. In case of venule, the HP is 30 and PCOP is 24. So 30 minus 24 plus 6, again the water, the HP is more. So again water is comes out, that leads to swelling of the tissue. So this is the simple understanding how the swelling is happening in the inflammations. Okay. Next one, there is the endothelial changes. So if this is the endothelium, so between the endothelium there is the interendothelial gaps. So if the gap is not happening, the fluid cannot escape from the blood vessels to the outside. So here we are discussing about the endothelial changes. What and all the endothelial changes taking place. So you can see here endothelial retraction. The simple understanding is retraction means shortening. You can see here it is a normal endothelium. Here you can see the shortening of the endothelium here. So that leads to there is a formation of the interendothelial gaps. So from these interendothelial gaps, that leads to water will be flows from the blood vessels to the extracellular place. Another one is a direct injury. Some of the external causes like a burn. So you can see some of directly will injure to the endothelium, that leads to formation of the interendothelial gap, that leads to the water will escape. Third one, WBC mediated endothelial cells. Some of the WBC will get injury of the endothelium, that leads to formation of the interendothelial gaps, that leads to formation of that leads to the swelling. So here in interendothelial changes, simple understanding, we are going to talk about the formation of the endothelial gaps. That's all. So because of this two mechanism, there will be the swelling taking place. So now we'll see in normal fluid exchange, the fluids are protein free fluid, we are calling as a transudate fluid. In inflammation, the normal fluid exchange which are protein rich fluid, this is a protein rich fluid called as a exudate fluid. Normal fluid we are calling as a normal fluid exchange we are calling as a transudate, and inflammatory fluids are calling as a exudate. So here the exudate fluid is the hallmark of acute inflammation, very important for the viva. Now we'll discuss about the what is difference between transudate and exudate, very important for the short note. So here we will study about some of the few difference of transudate and exudate. So transudate means protein free fluid without increase of vascular permeability. We are calling as a non-inflammatory fluid. Where there is exudate means protein rich fluid with increase of vascular permeability. We are calling as a inflammatory fluids. And the process of transudate is a passive process, where there is a exudation is the active process, and presence of cell may be low or absent in case of transudate, where there is high in case of exudate. What the type of cells? There will be more mesothelial cell will be present in case of transudate, where there is a neutrophil and lymphocyte will be present in case of exudate. Specific gravity of transudate is less than 1018, where there is exudate is more than 1018, and protein content is less than 3 gram percentage, where there is in the exudate is more than 3 gram percentage. And bacteria is absent in case of transudate, where there is a present in case of exudate. And examples of transudate is ascitic fluid in cirrhosis of the liver in case of transudate, and inflammatory edema. All inflammatory edemas are exudate. So that's about the difference between the transudate and exudate. So that's about the end of my. So now we are studying the summary of the today's class. The inflammation defined as local response of living mammalian tissue to injury due to any agents. The cardinal signs of inflammations are rubor, color, tumor, dolor, and functionalacia. Inflammation have two types: acute inflammation and chronic inflammation. Acute inflammation have two events, that is vascular event and cellular event. Vascular event of acute inflammation is vasoconstriction, leads to vasodilation, that leads to increased vascular permeability and stasis. So here the vasodilatation is responsible for heatness and redness, and increased vascular permeability is responsible for the swelling. So that's the end of my today's class. So let us discuss about the top 6 questions. So number 1 questions, most characteristic feature of acute inflammation. Number 1 is vasoconstriction, number 2 vasodilatation and increased vascular permeability, third one margination, and fourth one vascular stasis. Question number 2, rubor in inflammation due to increased vascular permeability, arterioles dilatations, stasis, and fourth one is edema. Question number 3, increased vascular permeability occurred at number 1 capillaries, number 2 arterioles, number 3 arterioles and capillaries, number 4 venules. Question number 4, first to appear in acute inflammation, vasoconstriction, vasodilatation, increased vascular permeability and vascular stasis. Question number 5, transmigration primarily occur in capillaries, arterioles, and venules. Question number 6, all of which is a family of selectin except L-selectin, P-selectin, A-selectin, and here it is none. Answer here, sorry, here it is none. And again here also it is the answer is none. Sorry, here it is the option is none. Okay, post your correct answer in the YouTube comment box. So if you are able to study this 6 question itself, you can understand that you can understood about the vascular events of acute inflammation. So study well. So this is my reference. Without this reference, the today's class, these are my reference. So without this book, today's class may not be fruitful. So thanks to those reference. I always end up with a small quoting. Knowledge is our power. So study well. Next class will go of the cellular events of acute inflammations. So thanks to all.